Hi, and welcome to a discussion regarding Chapter 31 in Nursing 150. We're going to focus a lot on cancer of the upper airways and look at some non-infection upper respiratory issues. Always the goal with all of these disorders, because we are talking about the airways, is to promote oxygenation and make sure that they maintain a patent airway. A lot of these disorders that we'll talk about may obstruct the airway, so that is the big focus of the nurse, is to promote oxygenation and making sure that the airway is patent. This is just a review of the anatomy of the nose and sinuses, just to let you have a visual of the areas that we're talking about as we go along. Cancer of the nose and sinuses are rare. They are typically slow growing, and they typically manifest as like a sinusitis. So we talked about sinusitis being an infection and inflammation of the sinuses. So typically when they start, a person begins to have a chronic sinusitis that is not treated well with antibiotics or the typical treatment for sinusitis, then they might, and I think we talked about this a little bit, they might just go to a CT of the sinuses to see if there's something in there that's causing the chronic, difficult to treat sinusitis. The problem with this is, as you recall, when you talk about cancer, you want to treat it early and treat it effectively. In order to do that, you got to find it early and treat it early. So a lot of times these are kind of progressed before we find them. So they will typically find a tumor, if this is the issue, after a couple of cases of difficult to treat sinusitis. Treatment for a tumor like this in the sinuses or the nasal cavities is typically trying to remove it, do a surgical removal, and basically, hopefully they've caught it in time before it's spread anywhere. And if you remember with cancers, if it's already spread to other areas, that's when it's a lot more difficult to treat. So, and they can try some radiation therapy if they need to try to shrink the tumor before they remove it. And as with any other cancer, the specific surgery depends on the tumor size, location, and the degree of invasion. So, these are issues that involve the airways. So, again, care of a patient with a tumor and a surgical removal of it would be to maintain, make sure we do what we can. Might be positioning, might be suctioning if needed. Just make sure we maintain that patent airway. There's a lot of body image involved in this if they have to have a surgery that maybe causes a disformity or, some abnormality in their face, because it is in their face, so it can cause some body image disturbances. Chemotherapy and radiation, again, could be a treatment, so just kind of make sure you review the care of a patient on chemo or radiation for these disorders. Head and neck cancers are, again, a slow-growing cancer that at times is not found until they have progressed. The two most common risk factors for head and neck cancer are tobacco and alcohol use, especially if they're used in combination. Other risk factors could be voice abuse. That's like you've heard of your singers that get the vocal polyps. That's kind of a voice abuse because they're singing all the time. Chronic laryngitis, exposure to chemicals, dust, and poor oral hygiene are your risk factors for this kind of cancer. Again, it needs to be found early and treated aggressively before it spreads, because the more that it progresses, the harder it is to treat. And it can become a big thing about their image, their body disturbance. If they get like a neck cancer, a lot of times they may end up with a tracheostomy, which is an artificial airway in their neck, if the tumor in their neck is obstructing their airway. So it can be a body image disturbance for sure. Here are the signs and symptoms of head and neck cancer. A lot of times the first thing is that you'll see in them is some chronic hoarseness, like their voice is hoarse chronically, shortness of breath, they might start noticing as well, especially if it's a tumor that might be obstructing their airway. There is a table on 589, table 31.1, that goes through the warning signs of head and neck cancer. Of course, pain, lump in the mouth and throat or neck if they find a lump, especially in the back of their throat, if they have difficulty swallowing. Color changes. A lot of times the dentist are looking, as well as your primary care physician, are looking for any kind of lesions in the mouth and the back of the throat. Any kind of lesion that doesn't heal in 2 weeks on its own should be checked further for head or neck cancer. So there's a lot of different things. Hoarseness is one of the other ones that is seen often with this chronic hoarse voice. And then, of course, anorexia and weight loss if it's progressed. So just make sure you review all those signs and symptoms. There's a few more of the signs and symptoms that could indicate a head or neck cancer, and these are all, like I said, listed on page 589. And again, the hoarseness and the persistent recurrent sore throat, shortness of breath, anorexia, and weight loss, all the signs and symptoms of head and neck cancer. And so these are possible treatments for head and neck cancer. Radiation therapy, we know, typically is done to try to shrink the tumor if possible, maybe before surgery, maybe just to try to shrink it along with chemotherapy. And again, it all depends on where the tumor is, how much it's progressed, and so forth. Chemotherapy, okay. Again, like I said, chemo and radiation could be together or separate. Chordectomy is a removal of the cords, the vocal cords, a partial removal. And then a laryngectomy, you can have part of it removed, like one true cord removed, or they might have to take out the entire larynx, hyoid bone, and 2 tracheal rings. So basically, somebody with a laryngectomy is going to have the ability to speak removed, and they may end up with a trach. So care of these patients with a chordectomy or laryngectomy is going to be definitely making sure they maintain their airway. If you look at your anatomy and physiology, that's all in your neck. So definitely that's the main goal of taking care of these patients post-operatively, is maintaining that airway. There's a table on page 591, table 31.2. It's surgical procedure for laryngeal cancer and their effect on their voice quality. So it kind of goes through these different types of surgeries that a patient can have, because the laryngectomy can be kind of divided into like a supraglottic partial laryngectomy or a total laryngectomy. So there's different varying levels of it, and that can affect if they're going to have a voice or not post-surgery. So the only thing I'm going to mention about if a patient ends up with a tracheostomy post-surgery is that it is an artificial airway, and that the nurse's job is just to maintain that airway, suction it if they need to be suctioned. Because just think about, we've put in an artificial airway, and then we've bypassed the nose and the mouth, which we talked about humidifies and filters your air that you breathe in. If they have a trach, they've lost that ability. If they have an artificial airway, they don't have the air going through the nose and the mouth like we do that filters and humidifies it. So it makes, their breathing pattern a little less ineffective. So we need to make sure that we keep that artificial airway patent. And this is just a visual picture of exactly what would happen after a laryngectomy, and this looks like a total one. So if you look, basically what they do is they've removed this part of the larynx, and then they've taken the part of the trachea and made a stoma here, and that's where the airflow goes in. They may or may not put a trach there, but they'll put some kind of an artificial airway to keep this patent here. It's usually a trach. And when they do that, then they've bypassed all of this protective ability that we've been born with to humidify and filter our air. So now the air is just going straight into the bronchioles, so it doesn't get filtered as well, and it's not humidified. So they build up more secretions from the air that's not filtered, and then it's not humidified, so it's thicker. So they build up these thick secretions, which can really easily kind of get blocked in here. So we need to keep it. We'll put like humidified oxygen on them, and then we have to suction them frequently to keep that thin and keep that stoma open. See, these are all the things that need to be done for a patient that gets a laryngectomy that we just talked about. Airway prevention always. And just make sure you monitor for hemorrhage. And that's always, they're more at risk for that, in the first 24 hours post-op. Wound breakdown, so that's the area around the stoma. It's, you got to make sure you take care of that area. Pain management, nutrition, and speech and language rehab are pretty obvious nursing interventions that the patient would require. Because remember, we said if they get a total laryngectomy, they do not have the ability to speak, but they can develop ways of communicating. These are just a few different pictures of some things that they can build to help the patient have their airway after that surgery. So you can see this is just like a little tube here, and that's where the air goes in, so you can see how easily that could get blocked with those thick secretions. This is just a picture of a electrolarynx that could be used to help lots of different things that they have available currently for patients to be able to communicate after they've lost their voice box. This one just kind of transmits like a vibration. It kind of works in the place of what your vocal cords do, and it allows the patient to make some kind of noise, and it is going to take some time with rehab to make sure that they can figure out how to make this work. It's just important to know that this would be important to the patient to be able to communicate. When you take away somebody's ability to communicate, it can be very devastating to them. So just so you're aware that there are ways that we can help them. There's lots of different things available, and so we need to make sure they have those resources. One other thing I'm going to point out to you on page 596, there's a chart 31.5. It talks about patients after a laryngectomy. Just review those. That's care. It goes through the different things that a nurse needs to do to take care of a patient. It talks about respiratory status, of course, condition of the wound, assess their psychosocial status. So if they are not able to communicate, make sure that they don't feel isolated. And then monitor them for signs and symptoms of any kind of infection, and monitor their nutrition status. This can affect their nutrition status. They're not going to be able to eat normally at first. They might have to have TPN or a tube feed for a short amount of time until they're able to maintain PO nutrition. Lots of teaching is going to be involved with somebody going home with a new airway, an artificial airway. So these are things that would have to be taught to them and followed up on. And hopefully they will do the smoking cessation. There's lots of tools that we have out there now to help people quit smoking. Lots of PO medicines, patches for nicotine, and so forth. And it's really important that we be supportive that they quit smoking. And the other thing is to make sure that people around them are not smoking as well. So lots of different teaching opportunities here. And that concludes Chapter 31. Please feel free to answer the review questions and the case study.